A colonoscopy. A colonoscopy helps find ulcers, colon polyps, tumors, and areas of inflammation or bleeding. During a colonoscopy, tissue samples can be collected, a biopsy, and abnormal growths can be taken out. A colonoscopy can also be used for screening tests to check for cancer and precancerous growths on the colon or rectum. To diagnose or treat, when do the doctors recommend it? A colonoscopy can help doctors find the cause of unexplained symptoms, such as changes in your bowel activity, pain in your abdomen, bleeding from your anus, and unexpected weight loss. To prepare for this procedure. To prepare for a colonoscopy, you must go on a liquid diet for 3 days, which means no solid food with the exception of jello. Nothing red or purple, but chicken and beef broths are okay, as well as anything you can see through. The step-by-step procedure for a colonoscopy. This procedure is performed by a doctor experienced in colonoscopy and lasts approximately half an hour to an hour long. Medications will be put into your bloodstream to make you feel more relaxed and drowsy. You will be asked to lie on the left side of the examination table. During the colonoscopy, the doctors will use an endoscope, a long, flexible, tubular instrument about ½ inch in diameter that transmits an image of the lining of your colon so the doctor can examine for any abnormalities. The endoscope is inserted through the rectum and advanced to the other end of the large intestine. There's no recovery time after your colonoscopy is done, so you can go home. But that's only if nothing's wrong. Immediately after your colonoscopy, you'll feel sleepy. So you'll be taken to the recovery room and given time to rest and regain your senses as the sedatives begin to wear off, which can take 1 or 2 hours. You may feel cramping or gassy as a result of the air that was used during the procedure. You'll also receive instructions about aftercare. You'll be told when you can eat and drink normally, which is often immediately after, depending on whether or not you did have polyps removed. You may be asked to refrain from taking certain medications for a short time afterwards. You'll also be told when you expect the results of any biopsies that are done.
Hi, I'm Dr. Higgins, and today I'm going to talk to you about magnetic resonance imaging, which you may know as an MRI. An MRI is a combination of magnetic field and different radio frequencies to make an image. An MRI is used to provide information about structures in the body that can be seen with an X-ray. MRIs also show problems that can't be seen with other medical technologies. MRIs are used to look at functions of the brain, heart, liver, soft tissue, and inside of the bones. MRIs are also used to diagnose cancer, brain disease, and cardiovascular conditions. A doctor would recommend an MRI if they couldn't get a clear image of the problem from an X-ray, or if you notice a problem yourself and the doctor recommended an MRI to gain knowledge of the issue. Before an MRI, you must stop eating and drinking 4 hours prior to the exam. However, you may be asked to drink a lot of water or just continue eating normally. It depends on which area is being scanned. Depending on your exam, you may be asked to drink a dye for people with kidney disease. Children or babies will probably have to use a sedative to make sure they remain still during the scan. Before your exam, arrive 30 minutes early and remove all clothes and jewelry to change into a hospital gown to ensure there is no metal once you enter the machine, or else that could lead to problems for you. While waiting in the hospital, you will be asked to fill out a questionnaire about your health and then wait for your procedure. Here are the steps of an MRI. Step 1. The MRI scanner will make loud tapping noises at certain times during the procedure. You will be given earplugs or headphones to wear. Step 2. You enter a short cylinder that opens on both sides. Step 3. You lie on a motorized bed that moves inside the scanner. Step 4. You enter feet first or head first, depending on which part of your body is being scanned. In some cases, a frame may be placed over the body part being scanned, such as a head or chest. Step 6. A single scan can take from a few seconds to 3 or 4 minutes. You may be asked to hold your breath during these scans. Step 7. The bed comes out of the MRI and now you can leave. Step 8. This procedure can take up to 15 or 90 minutes of you lying completely still. An MRI is usually carried as an outpatient procedure. After this scan, you can resume normal activities immediately. However, if you had a sedative, a friend or relative will need to take you home to stay with you for the first 24 hours. It is not safe to drive, operate heavy machinery, or drink alcohol for 24 hours after having a sedative.